What if changing just one simple food in your daily routine could transform your health, your brain, your gut, your blood pressure, your energy, even your memory? Would you be willing to give it a try? That's exactly what happened to Mr. Charles, a 73-year-old retired mechanic who had been taking 3 different medications for his heart, while also struggling with chronic digestive discomfort and poor sleep. His doctors chalked it up to aging, but Charles wasn't convinced. After consulting with a nutrition-focused physician, he began adding sweet potatoes to his meals in a medically guided manner, baked, portioned, and paired with specific nutrients. Within just 2 months, something remarkable happened. His stomach discomfort eased, his sleep became deeper and more consistent, and under close supervision, he was able to reduce 2 of his heart medications. His experience wasn't magic, it was food used properly. As I often say in my practice, food is medicine when it's eaten at the right time in the right way and tailored to the unique biology of aging. Sweet potatoes, often dismissed as just another starch, hold therapeutic power when prepared correctly and integrated into a senior-friendly diet. This video is not about trends or hype. It's about evidence, real stories, and a deeper understanding of how one root vegetable can quietly restore balance in an aging body. So let's dive into the science and practical benefits of sweet potatoes, one system at a time. As we get older, our immune system naturally begins to slow down, leaving us more vulnerable to infections, viruses, and longer recovery times. But what if one of the most powerful immune boosters wasn't found in a pill or injection, but on your dinner plate? Sweet potatoes, especially the vibrant orange variety, are loaded with beta-carotene, a nutrient that the body converts into vitamin A. This simple root vegetable could quietly become a senior's best defense against illness. Beta-carotene plays a critical role in maintaining the health of mucosal surfaces, the inner linings of the nose, lungs, and digestive tract, acting like the body's frontline barrier to keep harmful pathogens out. But even more importantly, vitamin A derived from beta-carotene is essential for the production and function of white blood cells, particularly lymphocytes, which seek out and destroy infections. Without enough vitamin A, your body's immune response is like a security system with no guards on duty. That's exactly what was happening to Mrs. Aliner, an 80-year-old retired librarian from Vermont. For years, she caught colds every couple of months and was often stuck in bed for days. Her doctor didn't think much of it, it was just aging, they said. But after adding baked sweet potatoes to her diet 3 times a week, Aliner noticed a shift. In just 3 months, she went from having 5 or 6 colds a year to only 1 mild episode. Blood work showed her vitamin A levels had improved, and she reported having more energy and fewer aches. Her story aligns with scientific findings. A study in the American Journal of Clinical Nutrition found that seniors with higher beta-carotene intake had stronger immune responses and fewer respiratory infections. Sweet potatoes offer a natural, safe, and nutrient-rich way to support immunity without side effects. They're also easy to prepare, roasted, mashed, or blended into soups, and can be a delicious habit for long-term wellness. Now that we've seen how this superfood helps rebuild immune defenses, let's move deeper into the gut, where another battle is quietly being fought. In the next section, we'll uncover how the fiber and resistant starch in sweet potatoes help stabilize digestion, reduce inflammation, and feed the beneficial bacteria that keep everything running smoothly. Digestive issues are prevalent among older adults, often showing up as bloating, irregular bowel movements, or chronic discomfort after meals. As the gut ages, it tends to become more sluggish and less efficient at absorbing nutrients. That's where sweet potatoes offer more than just flavor. They bring functional support to a struggling digestive system. Rich in both soluble and insoluble fiber, sweet potatoes help regulate bowel movements and improve overall gut function. But what truly sets them apart is their content of resistant starch and prebiotic fibers, which serve as food for the beneficial bacteria in the colon. When these prebiotics are fermented by gut microbes, they produce short-chain fatty acids, SCFAs like butyrate, acetate, and propionate. These SCFAs are critical to gut health. They help lower inflammation, improve the integrity of the intestinal lining, and even support immune function. Butyrate, in particular, has been shown to nourish the cells of the colon lining, speeding up tissue repair and reducing the risk of conditions like leaky gut and inflammatory bowel disease. To increase the amount of resistant starch in sweet potatoes, there's a simple technique. Cook them and then let them cool. Roasting sweet potatoes at around 375 degrees F, 190 degrees C until tender, then allowing them to chill in the fridge for several hours or overnight, transforms part of the starch into a more resistant form. This retrograded starch is not digested in the small intestine, but instead travels to the colon, where it feeds gut-friendly bacteria and boosts SCFA production. A practical example. Try roasting cubes of sweet potato with olive oil and rosemary, cool them down, and toss them into a quinoa salad or grain bowl the next day. It's not just tasty, it's therapeutic. Over time, this kind of dietary support can lead to better digestion, reduced bloating, and even improved mood, since the gut and brain are deeply connected. And now that we've looked at how sweet potatoes enhance gut health from the inside out, let's shift our attention to another crucial concern for seniors. Blood sugar. In the next section, we'll explore how sweet potatoes, with their naturally low to medium glycemic index, help regulate glucose levels and support those managing type 2 diabetes. For seniors struggling with unstable blood sugar, every bite matters. The wrong carbohydrate, especially one with a high glycemic index (GI), can trigger sharp glucose spikes followed by rapid crashes, leaving the body exhausted and craving more sugar. White rice and white bread, two staples in many diets, have notoriously high GIs, often ranging from 70 to 85. That means they break down quickly, flooding the bloodstream with glucose and forcing the pancreas to release a surge of insulin. Over time, this repeated pattern contributes to insulin resistance, fatigue, and worsening symptoms for people with type 2 diabetes. In contrast, sweet potatoes offer a slower, more stable ride. Depending on how they're prepared, sweet potatoes typically have a GI between 44 and 61, classified as low to medium. This makes them a far gentler carbohydrate source, allowing glucose to enter the bloodstream gradually while supporting longer-lasting energy and fewer cravings. The fiber content, especially the soluble kind, slows digestion and reduces the rate at which sugar is absorbed. Even better, the antioxidants like beta-carotene and polyphenols found in sweet potatoes have been shown to reduce oxidative stress, a key contributor to insulin resistance. One of my patients, Mr. Davis, a 66-year-old former construction worker, had struggled with poorly controlled type 2 diabetes for years. His HbA1c levels hovered around 4% despite medication. After discussing dietary options, he committed to replacing white rice and white bread with roasted sweet potatoes 3 to 4 times a week. He paired this change with lean protein and leafy greens. After just 60 days, his HbA1c dropped to 6.9%, a remarkable improvement. He also reported fewer energy crashes and a surprising boost in mental clarity. His success is echoed in research, including a 2008 study in the Journal of Medicinal Food that found sweet potato extract improved insulin sensitivity in diabetic patients. Clearly, smart carbohydrate choices can reshape metabolic health. But beyond blood sugar, another threat lurks silently within aging bodies: chronic inflammation. In the next section, we'll explore how anthocyanins and choline in purple sweet potatoes fight this silent killer and help reduce long-term disease risk. Chronic inflammation is often called the silent killer because it quietly damages the body over time, fueling conditions like heart disease, arthritis, type 2 diabetes, and even certain cancers. Unlike acute inflammation, which helps the body heal from injury, this low-grade, long-term inflammation operates beneath the surface, often without obvious symptoms until a major health event occurs. One powerful, natural tool to fight it: purple sweet potatoes. Rich in anthocyanins, the natural pigments that give them their vibrant color, these root vegetables have been shown to reduce inflammatory markers at the cellular level. Anthocyanins act as potent antioxidants, neutralizing free radicals and interrupting inflammatory pathways. A 2015 study published in Food and Nutrition Research demonstrated that purple sweet potato extract significantly decreased levels of C-reactive protein (CRP, a key indicator of systemic inflammation, while suppressing the production of pro-inflammatory cytokines. This means the body is better able to regulate its immune response without going into overdrive. Alongside anthocyanins, sweet potatoes also contain choline, an essential nutrient involved in fat metabolism and cellular repair. Choline helps regulate inflammation by modulating gene expression and limiting the release of inflammatory signals. For seniors, this is crucial. Not only does reduced inflammation protect the heart and joints, it also supports metabolic balance and brain health. Many of the aches, stiffness, and fatigue often dismissed as normal aging are rooted in chronic inflammation. By including purple sweet potatoes in the diet, older adults may be giving their bodies a daily anti-inflammatory boost without needing medications that often come with side effects. And speaking of aging, nowhere is inflammation more devastating than in the brain. In the next section, we'll look at how anthocyanins, vitamin B6, and antioxidants in sweet potatoes help defend against memory loss and cognitive decline, two of the most feared challenges of growing older. Memory loss and confusion aren't just frustrating, they can be frightening signs of cognitive decline, often linked to aging and neurodegenerative diseases like Alzheimer's. But growing evidence suggests that certain nutrients can help defend the brain against this slow deterioration. Sweet potatoes, especially the purple variety, are rich in anthocyanins, powerful plant compounds with antioxidant and anti-inflammatory properties. These anthocyanins help protect neurons from oxidative damage, reduce inflammation in brain tissue, and improve blood flow to key cognitive centers. Another brain-boosting nutrient found in sweet potatoes is vitamin B6, which plays a crucial role in the production of neurotransmitters like serotonin, dopamine, and GABA. These chemical messengers regulate mood, focus, memory, and sleep. Low levels of B6 have been linked to increased risk of depression and memory impairment in older adults. When vitamin B6 is sufficient, it enhances the synthesis of serotonin, a neurotransmitter that not only boosts mood but also supports the hippocampus, the region of the brain responsible for memory formation. I recall a patient, Mr. Clarence, a 71-year-old former professor who had been diagnosed with early-stage Alzheimer's. His short-term memory was slipping, and he often repeated himself or got confused during conversations. Along with medical care, we introduced dietary changes, including 3 servings of purple sweet potatoes per week. Within a few months, his family noticed he was more engaged, held conversations longer, and seemed less anxious. While nutrition isn't a cure for dementia, in Clarence's case, it became a powerful tool for slowing decline and preserving daily function. Supporting brain health through antioxidant-rich foods like sweet potatoes may be one of the simplest yet most overlooked strategies in cognitive aging. And while the brain benefits are remarkable, the eyes, our windows to the world, also face age-related decline. In the next section, we'll explore how vitamin A from sweet potatoes helps protect the retina, reduce night blindness, and maintain clear vision as we grow older. As vision naturally declines with age, many seniors begin to experience issues like blurry eyesight, increased light sensitivity, or night blindness. One key nutrient that plays a central role in preserving eye health is vitamin A, and sweet potatoes happen to be one of the richest sources available. The bright orange color of sweet potatoes comes from beta-carotene, a plant pigment that the body converts into vitamin A. This vitamin is essential for maintaining the health of the retina, especially the outer layer known as the photoreceptor cells, which are responsible for detecting light and sending visual signals to the brain. Without adequate vitamin A, these cells degenerate, leading to conditions such as dry eyes, impaired night vision, and in severe cases, full vision loss. More importantly, vitamin A is necessary for the production of rhodopsin, a pigment that enables the eyes to see in low light. Deficiency in this vitamin is one of the most common causes of night blindness in older adults. A landmark study published in 2005 in the Archives of Ophthalmology found that diets high in beta-carotene, along with vitamins C and E, significantly reduced the risk of age-related macular degeneration, AMD, one of the leading causes of vision loss in seniors. AMD damages the macula, the part of the retina responsible for sharp, central vision needed for reading and recognizing faces. By regularly consuming beta-carotene-rich foods like sweet potatoes, older adults can provide their eyes with the nutrients needed to delay or prevent this degenerative process. In practical terms, just one medium-baked sweet potato supplies nearly 4 times the daily recommended intake of vitamin A for seniors experiencing mild vision changes. This could be a simple, yet powerful dietary shift. And while supporting the eyes is crucial, so is protecting the heart. In the next section, we'll examine how potassium and magnesium from sweet potatoes work together to regulate blood vessels and support healthy blood pressure levels naturally. High blood pressure is one of the most common and dangerous conditions affecting older adults, often leading to heart attacks, strokes, and kidney damage if left unmanaged. While medications like diuretics are commonly prescribed to help flush excess sodium and fluid from the body, they can also deplete essential minerals like potassium and magnesium, both of which are critical for cardiovascular health. This is where sweet potatoes offer a natural, food-based alternative. A single medium-sized sweet potato contains over 500 mg of potassium, which helps counteract the blood pressure-raising effects of sodium. Potassium works by encouraging the kidneys to excrete excess salt through urine, helping to reduce blood volume and ease pressure on artery walls. At the same time, sweet potatoes are a good source of magnesium, a mineral that helps relax blood vessels, improve circulation, and reduce vascular resistance. Together, potassium and magnesium create a gentle but effective vasodilating effect that supports lower blood pressure without the side effects of pharmaceutical diuretics, such as frequent urination, fatigue, or electrolyte imbalance. A 2016 study published in the Journal of Medicinal Food found that participants who consumed 100 to 200 grams of boiled sweet potatoes daily for 3 months experienced a measurable drop in systolic blood pressure, with no negative side effects reported. Unlike drugs that merely address the symptom, sweet potatoes support the body's natural regulation of blood pressure by supplying the minerals it needs. They are particularly beneficial when paired with a low-sodium, whole-food diet. For seniors aiming to reduce dependence on medication or prevent hypertension from worsening, adding sweet potatoes to the weekly meal plan may be a simple but powerful move. Beyond heart health, sweet potatoes offer another major benefit, supporting healthy weight loss. In the next section, we'll explore how the resistant starch in sweet potatoes helps extend satiety, curb cravings, and reduce fat storage over time. For many seniors, weight loss becomes increasingly difficult despite eating less or exercising more. One of the culprits is a slowing metabolism and poor appetite regulation. That's where sweet potatoes, particularly those rich in resistant starch, can make a difference. Resistant starch is a unique type of carbohydrate that resists digestion in the small intestine and instead ferments in the colon, where it feeds beneficial gut bacteria. This fermentation process produces short-chain fatty acids like butyrate, which have been shown to improve insulin sensitivity, reduce fat storage, and promote satiety. Simply put, resistant starch helps you feel fuller for longer, curbing the constant urge to snack or overeat. To maximize resistant starch in sweet potatoes, one simple trick is to cook them and let them cool before eating. For example, roast or boil sweet potatoes, then refrigerate them for several hours or overnight. This cooling process changes the structure of the starch, increasing its resistance to digestion. You can enjoy them cold in a salad or gently reheat without returning to high heat, which may reverse the effect. Another effective approach is pairing sweet potatoes with a source of protein or healthy fat, like Greek yogurt or avocado, which further slows digestion and enhances satiety. Avoid adding sugar, marshmallows, or heavy butter, which can spike blood sugar and negate the benefits. A small serving of cooled roasted sweet potato alongside a protein-rich lunch may be more satisfying and metabolically friendly than a sandwich or rice bowl. Many older adults who have struggled with emotional eating or nighttime cravings have found that incorporating sweet potatoes as an early evening snack helped reduce their desire for sweets later. Supporting satiety is more than about willpower. It's about using the right foods to balance your hormones and gut signals. And speaking of hormones, one often overlooked factor in aging gracefully is skin health. In the next section, we'll explore how vitamin C from sweet potatoes supports collagen production, helping prevent sagging skin and maintaining a youthful glow. Skin aging is one of the most visible and emotionally challenging signs of growing older. Wrinkles deepen, elasticity fades, and the skin begins to sag, particularly around the cheeks, neck, and eyes. While this process is natural, nutrition can play a surprisingly powerful role in slowing it down. Vitamin C, found abundantly in sweet potatoes, is a key player in collagen synthesis. Collagen is the structural protein that keeps skin firm, smooth, and youthful. Without enough vitamin C, the body's ability to produce and maintain collagen drops sharply, leading to thinner, weaker skin and slower wound healing. Sweet potatoes offer a dual benefit. Not only do they contain vitamin C, but they also provide antioxidants that help protect existing collagen from oxidative stress caused by UV exposure and pollution. I once worked with a client named Marcia, a 68-year-old retired nurse who had grown frustrated with her skin's rapid aging. Together, we implemented a simple dietary change. 3 servings of roasted sweet potatoes per week, paired with daily consumption of citrus fruits like oranges and grapefruits. After 90 days, Marcia reported visibly smoother, more radiant skin, especially around the eyes and mouth. Her esthetician even commented on the noticeable change in firmness and glow. She hadn't changed her skincare routine, just her food. This anecdotal success is backed by research linking vitamin C intake to improved skin texture and reduced wrinkle depth over time. When combined with proper hydration and sun protection, a vitamin C-rich diet becomes a natural and effective skincare regimen from within. And while strong skin is important for appearance, strong bones are essential for mobility and independence. In the next section, we'll explore how nutrients like vitamin C and vitamin B5 support calcium absorption and help protect against osteoporosis in aging adults. Osteoporosis isn't just about aging bones, it's about silent fractures, reduced mobility, and the loss of independence that follows. While calcium often takes center stage in bone health discussions, the real picture is more complex. Vitamins C and B5, both found in sweet potatoes, play essential roles in supporting bone integrity and improving calcium absorption. Vitamin C is vital for the formation of collagen, which provides the flexible framework that calcium adheres to in bones. Without enough collagen, bones become brittle and more prone to fractures, even if calcium intake is adequate. Meanwhile, vitamin B5, also known as pantothenic acid, supports adrenal function and hormonal balance, both of which influence bone density, especially in postmenopausal women. B5 also contributes to the production of coenzyme A, which assists in the metabolism of nutrients needed for healthy bones, including calcium, phosphorus, and vitamin D. To make the most of these nutrients, it's helpful to pair sweet potatoes with foods rich in calcium and vitamin D, like sardines, leafy greens, or fortified plant-based milks. A meal of roasted sweet potatoes, sautéed kale, and grilled salmon provides a powerful combination of bone-building nutrients. For a plant-based option, try a warm salad with sweet potatoes, tofu, and sesame seeds over a bed of spinach. These combinations work synergistically. Vitamin C boosts collagen, B5 enhances nutrient metabolism, and the added calcium and vitamin D directly fortify bone structure. Over time, these habits can help reduce bone loss, lower the risk of fractures, and maintain better posture and mobility. But while sweet potatoes support the foundation of our skeletal system, they also contribute to cellular defense. In the next section, we'll dive into how beta-carotene and anthocyanins in sweet potatoes protect against cell mutations and reduce the risk of certain cancers. Cancer remains one of the most feared health threats in aging populations, and while no single food can guarantee prevention, certain nutrients have shown remarkable potential in defending against cellular damage that can lead to cancer. Sweet potatoes, especially the orange and purple varieties, are rich in two compounds with anti-cancer properties, beta-carotene and anthocyanins. Beta-carotene, a powerful antioxidant, helps neutralize free radicals that can damage DNA and trigger mutations. It also supports healthy cell differentiation, a process that keeps cells growing normally rather than dividing uncontrollably. Anthocyanins, the natural pigments responsible for the purple hue in some sweet potatoes, have been shown to suppress inflammation, inhibit tumor growth, and even induce apoptosis, programmed cell death, in abnormal cells. A 2013 study published in Nutrition and Cancer examined the effects of sweet potato extract on rats with prostate cancer. The results were striking. Those treated with the extract showed up to a 90% reduction in tumor cell growth and significantly lower levels of inflammatory markers compared to the control group. The researchers concluded that bioactive compounds in sweet potatoes created a less favorable environment for cancer progression, primarily by protecting DNA and disrupting the signaling pathways cancer cells use to multiply. While more human trials are needed, these findings add weight to the growing belief that antioxidant-rich foods can play a meaningful role in long-term cancer prevention. Incorporating sweet potatoes into a balanced diet isn't just about avoiding disease, it's about building resilience at the cellular level. And when your cells function better, your entire body follows suit. That brings us to another common concern for older adults: chronic fatigue. In the next section, we'll explore why eating sweet potatoes the right way can help restore energy levels, promote deeper sleep, and reduce feelings of physical and mental exhaustion. Fatigue is one of the most common and overlooked complaints among older adults. It's not always caused by overexertion. More often, it's the result of poor sleep quality, unstable blood sugar, and nutritional gaps that silently drain the body's energy reserves. Sweet potatoes, when eaten the right way, can help reverse this cycle. Their complex carbohydrates provide a steady, slow-releasing source of energy that prevents the sugar crashes often triggered by processed snacks or white bread. More importantly, sweet potatoes are a natural source of magnesium, potassium, and B6, all nutrients involved in muscle relaxation, serotonin production, and circadian rhythm regulation. Serotonin, produced from B6, is a key precursor to melatonin, the hormone that signals your brain when it's time to sleep. I once worked with a patient named Harold, a 74-year-old widower who hadn't had a full night's sleep in nearly 5 years. He would wake up every 2 hours, feeling restless and drained. After ruling out medical causes, we adjusted his diet by adding a small serving of mashed sweet potato to his evening meal about 4:30 or 5 p.m., paired with some lean protein and steamed greens. After just 2 weeks, Harold reported sleeping nearly 6 hours straight for the first time in years. He felt calmer in the evenings, less anxious, and surprisingly more energetic during the day. This small dietary shift helped restore his sleep cycle and improved his overall quality of life. Sweet potatoes work gently, supporting hormone balance, reducing inflammation, and providing clean fuel that the body can use overnight without overstimulation. For many seniors, that's exactly the kind of nourishment needed to finally break free from chronic fatigue. And now that we've explored how sweet potatoes can quietly transform everything from sleep to skin, it's time to step back and reflect. In the next and final section, we'll draw key lessons from these powerful benefits and show why this simple route might just be the most underestimated health food for seniors. 12 of the most common health challenges that affect older adults: high blood pressure, poor digestion, memory loss, weak immunity, insomnia, brittle bones, and more, may have one simple, affordable, and surprisingly delicious solution. Sweet potatoes, not as a magic cure, but as part of a consistent, intentional daily practice that works with your body, not against it. When eaten the right way and paired with other whole foods, sweet potatoes can quietly support healing, energy, and long-term vitality without relying on medications or complicated diets. This isn't about restriction, it's about smart nourishment. As I often tell my patients, growing older doesn't require suffering or deprivation. It simply requires eating with purpose. And sweet potatoes offer that purpose most naturally. If you're ready to give it a try, start small with a simple 7-day meal plan. Bake sweet potatoes with olive oil and rosemary. Steam and mash them for a comforting dinner side. Add chilled cubes to your lunchtime salad. Blend them into a morning smoothie with banana and almond milk, or pan-fry them with spinach and eggs in a hearty breakfast hash. 1 week, one food, countless ways to feel better. And if you notice even the smallest improvement, whether it's deeper sleep, steadier energy, or better digestion, don't keep it to yourself. Share your experience in the comments to help others who are still overwhelmed by prescriptions, confusion, or fear. Sometimes the greatest change comes not from another pill, but from going back to the basics, one bite at a time.